Okay, good morning. My name is Akerman. Thank you very much for the invitation. I'm very happy to be here, as Liz has told. Thank you for inviting a South American to the European conference as well. I'm a full professor at the University of São Paulo and also coordinator of the WHO Collaborative Center on Health Promotion called CPEDOC Cidades Saudáveis. I'm here to present something from Brazil, what I call the Brazilian case. The Brazilian case is in tune with the UNESCO chair because it's about the children, and more than a health promotion discussion, it's a health politics discussion, because by choosing this case to present today, I have chosen a political issue, and I'll explain why. Let's start poetically. This is the lyrics from a Brazilian song called Like Our Parents. And if you are intending to discuss about new generation, I think that the new generation tend to repeat what old generation did. That's why this song say, I don't want to tell you my great love from the things I learned from the vinyl records. I want to tell you how I lived, although my pain is to realize that even though we did everything we did, we are still the same and we live. We are still the same and we live like our parents. And then in terms of thinking about new generation of intersectoral action, we have to try not to repeat the same mistakes of the old generation. I really like cartoons because they are more precise than we academics. Here, Hamlet is talking to his dad. Why can there be peace and harmony in the world, Father? Peace can be possible, Hamlet, but there will never be harmony. There are many people to chant the same song. That's why intersectoral action is important, to give peace to the world. But harmony is something very difficult. But anyway, that's right. What do I intend to discuss with you today? What we really expect from a new generation of intersectorality, what we do in Brazil in general for intersectorality, what we do in particular for children and adolescents, which case did I choose to deal deeper, and what next? I took the liberty of suggesting some conditions for a new generation of intersectorality. First of all, that we do not treat intersectorality as a panacea for addressing inequalities. This is very important. That's why I asked the question to Liz, because although there is a potential in intersectoral action to produce, it's not easy. It's a political issue. It's about power. It's about transferring power. The second condition is that we understand that intersectorality does not necessarily reduce the conflicts inherent in human relationships. It may increase them. Third one, that intersectoral action does not presuppose giving up sectoral responsibility. This is very important because sometimes there are a type of immobilization. The sectors think if we don't do intersectoral action, we don't act. But maybe intersectoral action could be translated into integrated planning and sectoral action. Because this is not the panacea, this is not the new fashion. Sector articulation, and I show you some pictures to say what I mean by that. That sector articulation should be a fruit salad and not a fruit shake. Let's see what you think about that. And that maybe, as Didier and also Luis are saying, we need a theoretical framework for intersectorality. And also, we need a framework for intersectoral tackling health equity or social equity. As Luis has said, we need not only a theoretical framework, we need evaluation, we need research. And at the end, I'll present a framework for maybe dialogue with Didier and Luis, and producing theory and knowledge about tackling health equity with intersectoral action. Although there is an annoying distance between our prescription life as it is. No? There's no way to ignore that conflicts of interest and power pervade every human endeavor. It's naive to think that an intersectoral prescription would be an effective vaccine to immunize this constitutive element of human relations. But this is important, this is our ethical, political commitment. We can't turn it back on the fact that those with the most power resource will receive the largest share of the available resource, while the weaker will have to compete for the leftovers. It's our ethical, political commitment. Now my theory about fruit shake and fruit salad. If we think that to produce intersectoral action, each of the sectors, the fruits, to go into the shaker and produce vitamin, fruit shaker, I think that people, sectors, are not going to like to participate in this endeavor. Because look, we destroy the fruits, we destroy the sectors. The fruits doesn't have flavor, color, and taste. And people need to be identified in the arrangement. Maybe the fruit salad is the better metaphor for intersectoral action, because the fruits are there, they don't lose taste, color, and flavor, and they mix up in the orange juice. If you take out from this fruit salad the strawberry, you change the composition and the ideas and the proposals. That's why I'm saying that intersectoral action is much more a fruit salad than a fruit shake. Maybe an idea, I think that this study that Luz has just showed, it's a very nice study for producing theory of practice, as you were saying. It's not about defining intersectoral action, it's about producing knowledge on how intersectoral action functions. And maybe this could be a framework for thinking about theoretical path on what, on how, on with whom, what for, and why. And then framework, methodology, actors, intention, and paradigms could compose what I would try to say about theoretical path. What we're doing in Brazil in general for intersectoriality. I did a very brief revision. 66 of the papers I reviewed from the last 20 years in Brazil. And I found 18 policies, programs, and actions claim to be intersectoral. Cash transfer, child labor, food security, social protection, urban violence, LGBT, urban living, housing, domestic violence, and more health-related, health program at school, body practice and physical activities, mental health, alcohol and drugs, adolescent pregnancy, NCD, elderly, and fight against AIDS. I think that those are the things that the health sector by themselves are not able to solve, and then they ask help from the other sector. That's why I call, we are not looking for a patronized intersectoral action, but a generous one. A patronized intersectoral action is, I don't have the answer to solve my problem, then I ask the other sector to try to solve my problem. Maybe the general one would be, what's our common problem? And then we have to reframe the questions in order to produce intersectoral actions. As Luis was saying, there was this study, Intersectorality in Health in Brazil, at the beginning of the 21st century, a portrayal of experience. A lot of experience, collective empowerment, fight against violence, inequality reduction, sexual violence against child, adolescent, eye health, urban violence, lead poison, green environment, 9, integrated healthcare, dengue, and vegetable. And the main findings of this study is lack of intersectoral definition, partnership with education sector present in 10 projects, always health and education are together, and no impact on sustainability assessment. For example, those local projects were in place for 1 year, minimum, maximum 6 years duration. Main intersectoral cases with impact on child or adolescent. at first, I come to three possible cases present here in this event. I thought about presenting cash transfer, which is the Bolsa Família, 16 years, it's world famous, many fragmented evaluation studies, evidence of good results. Health program in schools, 12 years, not very famous. There's not a solid evaluation national study, evidence of not many good results. That could be a very good study to present, because you could learn much when there is no good result. But I decided, for political issue, to present to you today the Child Labor Education Program, because it's 23 years, it's recognized worldwide as effective, but and also because we've got an existing national evaluation study. But more important, child labor is increasing in Brazil. Because all the time we say about political will, but we have also no political will. The man who is now president of Brazil said, what's the problem with child labor? When I was 7 years old, I used to work in the farm of my father. When your president said that child labor is a natural thing, you have to worry about. That's why I present the Child Labor Education Program because it's being effective for all, but because of this testimony of this man, child labor is increasing in Brazil again. And then I choose this PEC, this program de Erradicação do Trabalho Infantil, is the Child Labor Education Program, which is an intersectoral program that within, then this is very important, when this program became part of a unified social protection system, it gained strength. It's very important when we talk about intersectoral policy, not disconnected to the political, the public policy system of the country. This system includes income transfer, social work with families, and the provision of living bonding service for working children and adolescents. It has national coverage, and it's developed in articulation with the 27 states with the participation of the civil society. Because there are partners in this arrangement. First of all, we have the Office of the President of the Republic. We have 9 ministers involved. We have social development, agriculture, labor, health, education, human rights, justice, tourism, and economy. We have the prosecution office involved. We have trade unions, workers and employers. We have the subnational areas, 27 states, 5,570 municipalities. We have private sector and civil society. We've got here everybody who is possible to be in this program. And also, it's very important because this program has an intersectoral articulation protocol. In terms of information, identification, protection, defense, monitoring, is specifying very clearly the responsibility of each sector. And effective in a way, since 1996 when the program started, now, in terms of children 5 to 9, 10 to 13, 14 to 15. And also, if you do use just federal data, we don't expand the databases. It's very important to integrate intersectoral planning because it favors sustainability. Sharing clearly the different responsibility between the parties, this is very important. Promote the alternation of protagonists, because if you have only one protagonist all the time, people get less interested in being in the fruit salad. More message. Intersectoral was most intense in this period, mainly because it was implemented at the territory level. I think that the territory level is the most privileged space to make intersectoral level to work better. The intersectoral action of the program was strengthened when it became part of the organic social welfare law. It's important that intersectoral action is not in the vacuum. I think that connected to a public policy. And as Luis has just said, intersectoral does not happen naturally. It needs to be deliberately built. It needs political will and professionals that make the articulation between the sectors, that act as true tellers. In this child labor program, we have community people paid by the government, paid by the private private sector to organize these activities. What next? First one, another cartoon. I think that our ethical political commitment. If life is a game, why it's never my turn to play? So this is very important, that we don't have to forget that. And suggesting that 3 generations for intersectorality. First generation, utilitarian. If the state is weak and minimal, let us complement research with other steps and share responsibility. Maybe we still are in this first generation. The second one, rationalize. Fragmentation, policy, and action compromise the efficient effectivity of the state. And the third one, the future, our aspiration. Generous interdependence. Intersector is not just the installation of multi-sectoral arrangement, but deliberate political decision to tackle inequalities. Thank you.
Thank you very much. Very good. I know that there are some questions coming from the people online, but maybe we need 2 minutes to let you answer the questions that Didier asked you before. So we begin by that.
Can you repeat the question, please?
Can you repeat the question?
It was the remark, about the question of the context and the contours, about the way you think that what Louise just says would be, relevant for your country, what differences, nuances you feel, because the question of generalization is, of course, very important for us. So just in 2 words, the way in which, from your point of view, context and cultures influences the practices of intersectorality.
I think that there are more universal issues than context issues, because we are talking about looking for a common good. And then I think that all context, this thing is full of conflicts. And I think that's how to deal with the conflicts in terms of looking for a common good. Because it's legitimate that the interests are diverse. But in order to tackle inequalities at the territorial level, we have to learn, this is in the context, how to produce common good.
So now I propose that we go for the questions that have been posed with people online. Yes. First of all, I have to say I had several feedbacks, and the online participants were really impressed by your talk. So first, I have 3 questions. Do you consider Brazil offers a context more favorable to intersectorality than European countries? Second question, there are many communities in Brazil. Do you have data about different kinds of intersectoral practices in different states and communities in Brazil? And last question, do you have a publication for the 3rd generation you talked about on your last slide? Thank you.
I have just invented this last slide to present here, and then okay, it's a good idea. I'll try to write a paper about these 3 generations. But anyway, I did that already in a paper that I published in 2014 in terms of waves, because I tried to compare the waves of the state with the waves of intersectoral action, because it's not possible to discuss intersectoral action disconnected to the reforms of the state, because that's something, intersectoral action is an answer that the different reforms of state ask us to organize because of the lack of resources, because of the conception of when the state is a solution or when the state is a problem. And I think that I did the same. When intersectoral action is a problem, when intersectoral action is a solution. This is the third question. And yes, there is a lot of activities going on, but not many evaluation going on. There's a lot of research starting about that, and but I think that I need something like Nunes has said. I have a student doing actor network theory using the Zika thing, trying to understand how this complexity regarding Zika can be studied as well. But I think that we need more to open the box of complexity, as Luis has just told. And I think that this view, Didier, we can apply this study at local level as well. But we have to think about resources, because sometimes people do intersectoral action because of lack of resources. They don't do intersectoral action because they have resources. They do that because they lack of resources. And we have to change how we do budgets, because budgets are related to sectors, they are not related to problems. And I think that this is something that we have to think as well. Thank you.
Thank you. My name is Martine Berger. I'm the head of health promotion and prevention in the Department of Education in Geneva, Switzerland. And, well, first of all, thank you for your presentation. And I think it articulates very well with the one made by Luis. But then also for your last remark on people doing intersectoriality for a lack of resources. And I think the resource question is a key issue. And in a way, I would like to question whether the system you present, your wonderful example of this 20-year success, I can imagine that it was very costly in terms of human resources, of efforts, energy to bring those sectors together, because you just said that I know that it's very difficult to combat this trend of working in silos. And with respect to Luis' presentation and to the need for a theory, I thought that we ought to think also about one thing, is what's going on at the highest level, the policy-making level, and what's going on in the field. Because in my past experience, before doing what I'm doing now, I worked for many years in international health development. And I've noticed from my experience that at the very local level, people tend to be much more intersectorial than we are at the policy-making or professional level. So, because they don't slice their lives into little different silos, and we do, because we lack resources, because we lack political commitment and so on. So my question to you is, how in that theory model that we are aiming to build, would you connect this, or would you compare how much resources and energy it takes to do things at the different levels? And how do you connect that together into a theory model that allows to pick up the most efficient ways, cost-efficient and effective ways of doing what we are all planning to achieve?
You're right. This child labor education program needed a lot of money. Not national money, there's a lot of donor money on that. As it is a complex problem, it doesn't relate to only one sector. It's imperative to do intersectoral action to eradicate child labor. You know? And at local level, I agree with you, it's much more easier, between inverted commas, to be intersectoral at the local level than at the global, because at the local level, life is not divided into departments, you know. But I think that Luis said $70,000, but as a salary of the person. There wasn't resource for building the benches. You know? There are resources for activating, but not resources for doing things. And then I think that maybe there are resources, intersectoral action here at the global level, more than the national level. When you arrive at the local level, there's no specific resource for intersectoral action. There are people paid to activate things, but there are no resources. And then maybe this could be something to test. The more resources, the less genuine intersectoral action. The less resource, more genuine intersectoral action.